Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is June 25th, 2025. This video is on two articles published in the New England Journal of Medicine. One by the Redefine 1 study group titled Co-administered Cagrilintide and Semaglutide in adults with overweight or obesity. And the second is Cagrilintide Semaglutide in adults with overweight or obesity and type 2 diabetes mellitus. First study designed is a phase 3A Redefine 1 trial in 22 countries, a 4-arm randomized control trial with 3,417 adults, no diabetes. Duration 68 weeks. Arms included semaglutide and cagrilintide combination, CagriSema, semaglutide, cagrilintide, and placebo. All groups received lifestyle support. Population mean age 47 years, 68% were women, 72% were white, and 18% Asian. Body mass index was around 38. 32% had pre-diabetes. Statistics: intention to treat with 99% power. Hierarchical testing. DEXA sub-study 7.4% for body composition. What did they find? 20.4% had weight loss with this combination versus 3% with placebo. 91.9% lost greater than 5% body weight. P-value 0.001. Body composition: there was a 35.7% decrease in fat and 14.4% decrease in lean mass. 54% of the obese reached non-obese body mass index. Clinical gains: systolic blood pressure decreased by 9.9 millimeters of mercury. Quality of life increased. 88% of pre-diabetics reversed to normoglycemia. Safety: GI events in 79.6%, serious adverse event 9.8%, discontinuation in 5.9%, 2 deaths, 1 due to cancer and 1 due to suicide. Key takeaway: the combination of CagriSema sets a new bar for weight loss pharmacotherapy, powerful and clinically relevant. The next study is Redefine 2 trial, which studied Cagrilintide, which is an amylin analog, and semaglutide, which is a GLP-1 agonist. It tested their fixed dose combo. Participants were 1,206 adults with type 2 diabetes and body mass index greater than 27. Mean age 56, 53% men, 66% white, and 29% Asian. Weekly subcutaneous CagriSema 2.4 milligrams each versus placebo for 68 weeks and lifestyle counseling. It was a phase 3A double-blind placebo-controlled 12-country randomized controlled trial. Primary endpoints: percentage body weight change, percentage greater than 5% weight loss. Statistics: intention to treat, multiple imputation, 95% confidence interval, greater than 99% power. Subgroup on continuous glucose monitoring, about 16%. What did they find? There was a 13.7% weight loss with the combo versus 3.4% in the placebo group. P-value 0.001. Greater than 5% weight loss in 83.6% versus 38.8% in the placebo group. Hemoglobin A1C less than 6.5 in 73.5% in the control group versus 15.9% in the placebo group. Systolic blood pressure decreased by 6.5 millimeters of mercury. Quality of life scores increased. The continuous glucose monitoring subgroup, the time and range increased to 86.8%. What were the adverse events? GI side effects 72.5%. 8.4% required discontinuation. Serious adverse events 10.4% versus 12.9% in the placebo group. Limitations: no monotherapy arms, 16.5 had continuous glucose monitoring. Majority were white participants. Key takeaways: the combination of CagriSema offers significant weight and glucose benefits in type 2 diabetes mellitus, strong contender in obesity, type 2 diabetes therapeutic space. The strengths of both these trials: large multi-center double-blind randomized controlled trials with greater than 4,500 patients across obesity and type 2 diabetes spectra, rigorous endpoints, DEXA sub-study for body composition, and global inclusion, especially REDEFINE 1, significant additive effect of amylin and GLP-1 antagonists, greater than 20% weight loss in many. Limitations: limited long-term, greater than 68 weeks outcome data and real-world durability. REDEFINE 2 lacked monotherapy arms, and REDEFINE 1 had limited DEXA sampling for body composition, just 7.4%. High GI side effects, unclear best patient phenotype for CagriSema. Predominantly white female cohorts. Generalizability is of concern. Bottom line, CagriSema is a promising dual agent therapy with profound metabolic benefits, but further data are needed on long-term safety and broader applicability. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.